Welcome back to the show. The pandemic has taken a toll on all of us, disrupting our physical health, our routines, and of course, our God-given right to toilet paper. For the first 90 days of quarantine, my entire family just held it. But the pandemic has been especially punishing to another component of our health.
The mental health wave of this pandemic has been like a second wave.
A 24% increase in child emergency room visits for mental health, a 31% jump for teens.
56% of people said worry or stress tied to these outbreaks have led to at least one negative effect on their well-being, including things like trouble sleeping, eating, and alcohol use.
Even fictional people are having a hard time coping. For example, no one has suffered more than Miranda Hobbs. She's an entirely different person now. If she goes to one more comedy concert, there's no coming back. Of course, our mental health system wasn't exactly perfect before the pandemic.
More than 43 million Americans suffer from depression, anxiety, or other mental health issues. But more than half never get help.
There is a huge shortage of child psychiatrists. There is a huge shortage of therapists.
Is your insurance enough to cover the healthcare needs?
For a residential center, it probably will only cover 50%, and that's not cheap. That's like $3,000 a day.
$3,000 a day? No wonder Charlie Brown keeps going back to Lucy. It sure ain't because she's a good listener. All she hears is... The healthcare industry has historically treated mental health as an afterthought, far less important than physical health. And of course, that outlook is largely motivated by money.
If you make things too difficult to access, then patients will stop trying to seek the therapy and the treatment that they need. And I guess part of me thinks that that's probably a good thing for the insurance companies.
Insurance companies used to be able to charge higher copays for psychiatric care than for other medical treatments and limit the number of visits, all the way up until 2008, when the Mental Health Parity and Addiction Act forced insurers to cover mental illness equally.
That's not to be confused with the Mental Health Parity and Addiction Act, which funded Weird Al Yankovic's potato dependency anthem, Addicted to Spuds. That song saved a lot of lives. Even though the Mental Health Parity Law and the Affordable Care Act require certain plans to provide mental and physical health benefits equally, mental care continues to lag far behind. Being hospitalized for mental illness can cost thousands of dollars, and even regular talk therapy can easily cost $300. For most people, their best chance of getting therapy is being cast on Queer Eye. People say Antoni barely does anything, but he's still helping more people than the insurance companies. When you're experiencing a mental health crisis, it can seem impossible to shop around and navigate all of the obstacles of your insurance, which may set unreasonable criteria for you to qualify for coverage. Like when an insurer decides someone isn't depressed enough to be hospitalized. That's like saying, sorry, buddy, no cancer treatment till you bulk up that tumor a little. There's also a critical shortage of psychiatric beds, forcing patients with severe mental illness symptoms to be held in emergency rooms and jails while they wait, sometimes for weeks. This leaves people with serious mental illness even more vulnerable. To make matters even worse, many mental health providers don't accept insurance at all because companies don't reimburse them enough. Like Frazier, he only accepts tossed salads and scrambled eggs. In the U.S., 129 million people live in areas with a shortage of mental health professionals. So even if you have coverage, finding help can still be difficult.
She has insurance through Blue Shield.
They emailed me a list of providers. They all have a 3-month waiting list.
I called 100 psychologists in San Francisco who take Natalie's insurance. Half said they're no longer taking insurance or new patients, and a quarter never even called back.
Yeah, but she was leaving voicemails for all of them. If someone leaves a voicemail, eat ass. You don't deserve a call back. While therapists were in short supply even in the before times, the pandemic has led to a spike in demand, along with burnout among mental health workers. Patients may also face difficulty based on geography, thanks to an unequal distribution of psychiatrists, psychologists, and psychiatric nurse practitioners across the United States. Contrary to the traditional image of the friendly, small-town Freudian analyst, mental health workers are sparse in rural areas.
I probably have well over 350 patients in my case files. My receptionist turned down 8 people for requesting new appointments to come and see me. Despite our best efforts, we haven't been able to attract psychiatrists here.
Maybe you should try negging them. Just say, that's a cute couch. Not hot, cute, then walk away. The lack of adequate mental health care is even worse for Black patients who can only see a therapist who looks like them on every single show on TV. At a time when millions of Black people are in desperate need of therapists who can identify with their struggles, only 3% of the psychology workforce in the U.S. is Black. The other 97%? Billy Crystals. So what can save us from the mental health crisis? Well, the internet sure is trying, or at least they're trying to monetize it. If you've ever listened to a podcast, you've heard ads for therapy apps.
This is my game face, but this is my real face and my keeping it together face. That's when I find my online therapy face.
If you're curious what that is, online therapy face is literally the opposite of your O face. Therapy apps advertise themselves as making mental health care instantly available and easy to access, although the bot captcha test I took was oddly very cruel. I spent my first 2 sessions just talking about that. Believe it or not, there are an estimated 10 to 20,000 mental health apps, but only one app for farmers only. How is that fair? And while it's great that people who aren't rich or characters in a New Yorker cartoon can talk to someone, many apps blur the line between health providers and tech bro ventures with little oversight of their practices. Former employees on one app claimed they were pressured to keep clients in their system rather than refer them to outside resources, and that seemingly private therapy transcripts were mined for marketing purposes. That is so unethical. Your therapist is telling you staying in bed all day is a sign of depression, but your algorithms are telling you, here's another ad for the weighted blanket that could be your one reason for living. Then there are apps that don't connect you to a human. They're just automated self-help programs offering mood trackers, daily affirmations, and even artificial intelligence to talk you through your problems. Because there's no better way to fix the damage inflicted by your cold, heartless parents than by pouring your heart out to a robot. These apps may offer short-term help, but they lack the depth of a human who can listen to your problems, offer thoughtful feedback, and try not to cringe when you tell them the weird shit you did with the dude you met at the Pensacola Stuckies. A robot simply cannot process that degree of shame. Our lack of affordable, accessible mental health care has serious consequences, especially in these uniquely hellish times with surging rates of depression and anxiety. Who knew actual clinical help couldn't be replaced by making sourdough bread? 1 in 5 adults in this country and 1 in 6 children experience mental illness, yet half go without treatment. People shouldn't have to suffer or go into debt because our health system treats a well-functioning brain as a luxury. This may shock you, but studies show the brain is actually one of the most important parts of the body, right up there with parts that are more widely covered by insurance, like elbows and anuses. We need stronger enforcement of the mental health parity law. We need insurance companies to increase reimbursement rates and include more providers in their networks. But most of all, we need to acknowledge that all illness is illness and deserves to be treated, whether it's a mind suffering anxiety or a body suffering injury after a sudden fall. Isn't that right, America's favorite therapist?
Trip through It's a Small World, pretending I was a UN interpreter. Oh, good Lord.
We'll be right back. Sorry. Dear Lord. We'll be right back. Sorry, I have to do that again. No, so let me do one clean. It's my favorite. This is one of my favorite clips of all time.